NHCC is the public benefit corporation that manages Nassau County's only public hospital, NUMIC, public SNF, A. Holly-Patterson, jail infirmary, and co-operates health centers. We are a level 1 trauma center, recertified again in 2024. We have the only burn unit in the county and the only multi-place hyperbaric chamber on Long Island. We served over 275,000 patients in our award-winning emergency room last year. We are a teaching hospital with over 350 residents that are learning from the best at a mission-driven institution. Currently, we have over 440 people who call A. Holly-Patterson their home. We have over 3,600 dedicated employees, mostly CSEA, who have been out of a contract for over 2 years. 2 years is too long, especially as this is our first contract after caring for our community during COVID. NUMIC is the designated hospital for inmates and for all residents of the United States. We provide high-quality health care to all. I'd like to note I submitted written testimony with details of our robust services and our improvements, as I'd like to spend my time today to advise you of the reforms implemented, the expansion of the access of care, and our improvements since I last came before you. I pledged to you a year ago, only a few days as the interim CEO, that I would institute a series of reforms that would require less aid year after year, a reduction in gap funding. I am proud to inform you today that this pledge has been fulfilled. Over the past 12 months, we expanded access of care and increased services to our community, all without a dollar from New York State. We increased our clinic hours, which resulted in an additional 16,700 visits in 2024 compared to 2023. We began MRIs under sedation as an additional revenue stream. We restructured departments to optimize savings. We waived copays for our employees who opted to get health care at our facilities, and so much more. Despite certain press and others misrepresenting that we were running out of cash in 30 days, proven to be false, we did not. We recruited and retained employees. We closed the 2024 year with over 600% more cash in the bank than 2023. This is with a patient-payer mix of 80% Medicaid, Medicare, and no pay. While reviewing all of our funding sources, we uncovered that NUMIC has been fronting the state's share of Medicaid DISH payments, which has hurt our bottom line for decades. We currently are disputing this with the state, raised the issue with the feds, and we hope to resolve this issue soon, because the law is quite clear. The poor Medicaid hospital should not be paying millions of dollars annually in order to access federal funds. Last year, we applied for 4 New York State VAP grants and 2 transformation grants, and sadly, we were not awarded any. I am pleased to report that we no longer qualify for VAP today because our finances are stronger than a year ago. I'd like to also note the executive budget proposal to amend a law that was never used in the history of New York State to give DOH the increased power to install a temporary operator without a hearing first. This move is inappropriate in the budget process, and I look forward to discussing this proposal with you. We've been under NYFA authority for 5 years. This administration provides daily cash balances, timely financials to NYFA and to our board. I'm asking for a restoration of our aid and for funds to help advance the 2025 CSEA contract. Our employee salaries are less than any other public hospital. We have dedicated employees that care for the poorest and sickest in our community, and they deserve to be paid a fair and equitable wage. New York State is funding all other hospitals, and it's unacceptable that NHCC has its Medicaid payments halved. Thank you. I appreciate your support.
Thank you. Meg, thanks for making the trip up. Just wanted to ask a couple questions regarding the current state of the hospital. As we know, DOH has had some, I guess, back and forth with you guys, letters and things of that nature, but has the New York State Department of Health actually sat down with you and your team at the hospital to discuss the hospital, its finances, and all of these issues?
No, Assemblyman.
So it's basically been letters that have come
Yes.
to you. And
So DOH has asked us has corresponded with us since last year. We have responded to all requests, and we have asked for meetings from DOH, and sadly they have not fulfilled our request. So we have not had a meeting with the Commissioner of Health or his team, and the last time the Commissioner of Health team or the Commissioner of Health came in was in 2017. So it's been a while, and the last time we had a call with DOH was back in March regarding our VAP application, which I said we're no longer qualified for that program anyway right now because our finances are in a stronger position.
okay, and can you just detail that again, where the progress that has been made with regard to the finances over the last couple of years, because it is pretty remarkable, the strides
Sure.
you've made.
So early in 2024, we had $11 million in the bank. That covered one payroll. We ended 2024 with $90 million in the bank. We do pay our bills. We are, we have restructured our departments. We have optimized our savings. The reforms are working. We improved our quality scores. We went from a D that was stuck at a D for 6 years to a national score of a C. We passed every DOH survey that occurred, 10 of them in the past 11 months, and we were recertified as a level 1 trauma center the same day that we had our joint commission accreditation. So we got hit twice in the same day, and we passed both with flying colors. So we are making finance improvements, quality improvements, and it's disappointing that we're not able to sit down and reveal these great improvements with DOH and the state.
Okay, thank you. And I think just in terms of your services, I know Senator Rhodes brought this up with the commissioner earlier, the burn center, something obviously that's important to our volunteer firefighter community, all of the other resources that are there and would disappear for Nassau County residents, particularly, central, western Nassau County, if, NUMC doesn't survive. So I appreciate the strides you and your staff and your team there have made in moving forward, and know that while sometimes you hear different noise coming from Albany, I think amongst your legislative delegation you have a lot of support here to help move you guys forward.
Thank you so much.
Thank you.
Thank you, Madam Chairwoman. To Nassau Healthcare Corporation and Meg Ryan, now that you've had an opportunity to catch your breath.
Yes.
Just the list that you went through of accomplishments is quite impressive. Could you summarize what your financial position was at the start of 2024 versus what it is today? In other words, at the start of 2024, I believe Nassau Healthcare Corporation had a projected deficit in excess of $100 million.
Right. So in our we were expected to lose in 2023 $180 million, and we lost $80 million. And we ended the year, or early in, 2024, we had $11 million in our cash positions, which would that covers one pay period. And then we closed the end of the year with we had 89 point something, so $90 million in our cash positions, and we are, we're doing our 2024 audit. We just began that right now.
Okay. And I know that Assemblyman Ra had alluded to a number of requirements from the Department of Health that were supposed to be tied to additional state funding. And correct me if I'm wrong, Nassau University Medical Center has lost probably in excess of about $500 million in state funding versus historical averages over the last 6 years. Is that correct?
Correct. That is correct. And we uncovered this DISH scheme that we've been fronting the state share of the DISH payments for decades. So that totals over $1 billion. So last year alone, we put up $50 million of the non-federal, the state share of the money. So if we just had that $50 million from the state, we would have a $30 million loss. So we would close the loop. So
you'd be close to break even at that
Correct.
point. So in the last year, because when I asked Commissioner McDonald what the holdup was on receiving funding, he spoke about leadership.
Sure, I'd like to.
He spoke about leadership at the hospital. So what you're telling me, under your leadership in the past year, you've closed without any state funding and without any state funding for the last 5 years, you've closed a $100 million gap in operating. You've cut your deficit by $100 million.
While expanding our services.
While expanding services, while 83% of your patients have no insurance, Medicare or Medicaid, your Medicaid reimbursement rate is 72 cents out of every dollar, so you're losing 28 cents out of every dollar of Medicaid coverage that you provide to a patient, right? What more are we looking for in terms of leadership than what's being provided right now? And to the governor and to Commissioner McDonald, stop playing politics with the leadership of this hospital. Provide the services that Nassau County residents need from their only safety net hospital, and provide them the funding that they need to be able to continue to serve our residents.
Thank you, Senator.
It's for President Ryan. Despite you just saying that you pay your bills, it seems that Newmark hasn't paid their health insurance bills. So
That
the
is
hospitals
incorrect.
owed $400 million to Night Ship.
Sure, I'd like to address that. So we do pay our bills. We pay our night ship every month. $2 million under a plan that was implemented under our chairman and CEO of the time. So he was doing double duty, and there was no questioning of his leadership, George Tunis, under the current administration. So under that payment plan, which I did not make that deal, we have paid monthly, timely, so we are up to date under that contract. So contractually, we are up to date. And if our dish payments were paid appropriately, we would be able to pay more to the night shift.
And how much does the hospital spend on multiple mailers that have gone out to Nassau County families criticizing the state over the last few
I
months?
don't have that on me. Not as much as
You
we
don't
should
have an assessment about how
We
much you
should have
spend on
spent more.
mailers?
We did pay. Yes, we did send mailers. Yes.
Okay. And how much do you pay for those mailers? Could
don't
that
have
have
that
gone
number on me. I
to
can get that.
patient care and
I
services?
can send that to you. I don't have that.
Okay, I would love to have that information. And then what's your vision for the hospital? Does it ensure that you're going to have partnerships with private hospitals? Are you going to do real estate development? What's the vision for the hospital?
Sure, I'd like to have strategic partnerships. I think it's very important. I think the bad press that we're having and this back and forth with the Department of Health is hurting those strategic partnerships and hurting recruiting. We are not opposed to anything going forward. Strategic partnerships, we have many partnerships with other hospitals right now. Northwell, we have different alliances with Northwell, the Catholics, and we're actually just 2 days ago, we contacted another hospital in the city that we are looking to work with. So we are not opposed to any strategic partnerships. Right now, my vision is to keep the doors open. I'm proud that we have not done any layoffs in the past year. So I want to keep our doors open. I want our CSCA contract to be complete in 2025, and I want to keep our services going. We are evaluating any services that are needed for the community. We are keeping anything that we think is not optimizing.
So
we are
what
cutting.
specifically long-term financial plans do you have for the hospital? So that
To
it
get
could
our
be
funding from New York State that we're entitled to, so we can continue our services. Being the first responder hospital for Nassau County, being the only burn unit, we are 80%, we are serving the poorest of the poor in Nassau County, and we want to continue those services and make sure they have access to care. We just purchased a new mammogram van that every politician on both sides of the aisles uses. We'll be getting that next month. We had a fundraiser for that and raised $560,000 to put towards that. So we're looking to what services the community needs, and we're responding to those.
So how are you generating revenue for the hospital?
How we generate-
Aside from begging for the state aid, what is
I
the
just told you,
hospital doing internally to generate revenue?
I just told you, we optimized our services. We went through each department and we restructured services and staff. So we did that in the past 12 months. We increased our services by expanding our clinics. That's an extra revenue stream. We're adding more.
And is this sustainable to ensure that the hospital?
It's not sustainable without state aid. We treat Medicaid patients, so we need our subsidies. Thank you.
You quoted very fastly, I might add that, the successes of the hospital, but I just want to go over some things that, well, first I have some questions, this series of questions. So the budget, you guys are asking for what operational costs to operate efficiently at the most opportune level that you could. What's the ask?
Well, I think the ask is we're asking for whatever we can get. I mean, but if we can put money aside to allocate for our CSCA contract. So besides the contractual funds, we're asking for $25 to $30 million.
Okay. Now, some of the things that I've heard is in response to the state. You guys are saying the state, and I don't think this is a board comprised of the state. It's comprised of elected officials who represent our constituents, and so we aren't just the state. We're people who actually know, who actually have gotten phone calls, emails, and there are issues that we've been hearing for years, and so I like to base my life in reality. And so I'm going to ask a question, and anyone can answer. Why is it that you think we can hear these numbers? You lost you were in a $100 million deficit, but you were able to successfully fund that hospital. You're asking us for more, but why is it that you were in that deficit? And to say that it's just you weren't funded, I don't think that's the answer.
Well, there were years of mismanagement prior to this administration. We were defunded. There were programs that went away. We went through that a year ago. I have a chart of that. So I'm numbers based too and data driven. So when you reduce, you're reducing our funding, but we're still seeing the same amount of patients, if not more. And we're providing better services and high-quality service. We just raised our grade, a national grade, from a D to a C. So we still need our subsidies. Then uncovering this dish payment, unfortunate plan that we haven't been getting our state share of money for decades, year after year. But the hospital, I want to be clear, has been putting that money up. So we put the money up to the state. Then the state tells the federal government that they have the non-federal share, the state share. This federal government sends the money to New York State, and the New York State sends our money back with the federal money. So year after year, we just got, halved last year by $50 million, and it's going to happen again this year, probably to the tune of $38 million, unless we come to a resolution. So, I think to put it on this administration that we're asking for funding it's inappropriate. We're advocating for our services and for our employees and for our community.